Hi guys, so this is the chapter 4 key points for OT101, the endocrine system. The endocrine system happens to be one of my favorite body systems, which I know is kind of weird, but the endocrine system is truly amazing. It deals with all of your hormones and all kinds of stuff that's kind of behind the scenes. And it's pretty interesting. So we start with talking about endocrine glands. Endocrine glands secrete chemicals called hormones into the bloodstream to be delivered throughout the body. So the thing to remember about endocrine glands is that they are ductless. They do not empty out anywhere outside of the body, which means that all of their secretions stay inside the body and then circulate via the bloodstream. So I'll show you a little picture here. This is the difference between an exocrine gland and an endocrine gland. So an exocrine gland, such as this one, a sweat gland, is going to secrete something and it's going to end up on the outside of the body. So like when you sweat, you can see your sweat, you can feel your sweat on the outside of the skin surface. Opposed to that, endocrine glands secrete their hormones into the bloodstream, and then the bloodstream carries them all around to wherever they need to go, and you never actually see them. They stay within the body. They are encapsulated, if you will, and they are endocrine. Alright, so hormones perform general functions of communication and control. They connect the glands and the tissues within the body so that they can communicate with each other, and then they also exert control over most major bodily functions. So the endocrine system's hormones work very much like the nervous system's nerve tissues, except that the hormones are much longer acting than nervous impulses are. So the nervous system exerts very short amounts of control. Both nervous system and endocrine system have very definitive controls, but the nervous system acts very quickly. For example, you reach your hand out to a hot surface. Before you touch the hot surface, the nervous system will send out a rapid impulse to your nerve endings and tell you, hey, don't touch that, that's going to burn you. And so it's a very quick acting. Your endocrine system is a little bit different in the fact that it exacts longer acting control, or exerts longer acting control over your bodily functions. So you do not have to consciously tell your thyroid gland to produce hormones. Your body just does that, and then it uses those hormones. Well, ideally it does it. If your body is healthy and your thyroid gland is functioning properly, it will do that, and then it will use those hormones to exert longer acting control over the body systems that it is to control. So it's kind of cool. Man, what a pain it would be if we had to tell our hormones what to do, huh? Although sometimes I think some of us would like to. Target organ cells, these are the cells that are acted on by the hormones. And they are cells that have receptors for a specific hormone. So if you can kind of picture in your mind a lock and a key, that's kind of how this deal works. So the target cells kind of are the lock, and then the hormones have the key to unlock that target cell receptor, and they fit together perfectly, and then they get to work. So if the wrong hormone goes into the wrong receptor, or into a receptor that it doesn't fit in, then we have hormone insufficiencies, or that's where kind of disease processes may start. We will have hyper or hypo issues, or some other things happening. So generally it doesn't work well. Okay, so regulation of hormone secretion, some things you need to be aware of here. Hormone secretion is controlled by something called homeostatic feedback, and this stuff amazes me. So the first one we'll talk about is negative feedback. Negative feedback are mechanisms that reverse the direction of a change in a physiological system. You need to know that 98% of your body systems function off of a negative feedback loop. This is important to know. I mean, this is pretty substantial stuff. 98% of your body systems work off of this negative feedback loop. The other type then would be the opposite of that, and that's a positive feedback loop. These are very uncommon in the human body. These are mechanisms that amplify changes in a physiological system. So I have a couple of examples, and I'll show you the difference between the two. In a negative feedback loop, A patient's blood glucose level will rise, or a person's blood glucose level will rise. That elevated blood glucose level is going to trigger the pancreas to release insulin. The insulin that is raised will then counteract the glucose, which will cause the glucose levels to drop. That's kind of how insulin and glucose work. Since the glucose levels have lowered, the pancreas will stop producing insulin because it doesn't need it anymore. It thinks that the insulin level is okay in the blood, so it will stop producing insulin. Eventually, though, the blood glucose levels will begin to rise again since there's no insulin being produced to keep them from rising, and the cycle will start all over again. And so this is how, in a typical healthy person, the negative feedback loop works for blood glucose control. Blood glucose levels rise, elevated glucose levels trigger pancreas to release insulin. The insulin counteracts the glucose, causing the glucose levels to drop. Since the glucose levels have lowered, the pancreas will stop producing insulin. Eventually the blood sugar goes up again, insulin kicks in and starts to produce insulin. The pancreas will kick in and start doing its job again and all of that. So here we go. This is the whole big negative feedback loop. It goes like this. This is how 98% of your body systems work, on these negative feedback loops. Okay? So then to show you a positive feedback loop, this is the thing with negative feedback loops. Let me flip back here really quick. These negative feedback loops are not terminal. They have no end. As long as everything is working correctly, they do not stop from the time you are born to the time you die. They work continuously, non-stop. So opposed to that are positive feedback loops. So an example here that I listed is the delivery process, labor and delivery process. So labor begins and then progresses with each subsequent cycle or phase of labor. The cervix dilates and thins, stimulates the production of oxytocin. Oxytocin hormone stimulates the uterus to contract and push the baby downward. The cervix then dilates, the cervix will dilate, oxytocin is produced, the uterus contracts, and the cycle is going to repeat. So this cycle is going to keep repeating itself over and over and over again until the baby is delivered. So the cycle stops after the baby and the placenta are delivered. Once the baby and the placenta are delivered, there's no need for any of this to happen any longer. So the feedback loop comes to an end. That's the major difference between negative and positive feedback loops, is that negative feedback loops have no end. Positive feedback loops are continuous until they terminate. So just to kind of give you an overview there. Okay, so mechanisms of endocrine disease. You have hypersecretion, and that is the secretion of excess amounts of hormone. This is most likely because of target cell receptor problems. So that lock doesn't fit in the key doesn't fit in the lock rather very well, or it's a little shaved down, or something isn't quite right with that lock key combination. You have hyposecretion, which is an insufficient hormone secretion. You have polyendocrine disorders. Those can be hyper or hypo, so too much or too little, of one or more than one hormone. So it could be one single hormone that you have not enough of or too much of, or it could be multiple hormones that you have not enough of or too much of. Target cell insensitivity produces results that are similar to hyposecretion, which is the insufficiency. If the usual target cells have damaged receptors, then they will not respond to the hormone correctly. So in this case, with the target cell insensitivity, the lock and the key fit together, but the lock has got some personality conflicts. The lock has got some kind of midlife crisis going on or something. I don't know. But the lock has some kind of issue that makes it insensitive to the key, and so then it causes some insufficiency issues with the hormone overall. Endocrinologists have developed many different strategies for treatment, including surgeries and hormone therapies. I used to work for an endocrinologist. The guy had the personality of a wood plank. I'm not even kidding. He was the driest personality. He used to call my kids, I had pictures of my children on my desk, he used to call them little people. He refused to acknowledge them by name. It was by name. He was just an odd guy, but he was brilliant. He was a brilliant physician. I learned so much from him, and he actually is a large part of the reason why I have such a passion for endocrinology, because I was able to learn tons and tons of stuff from him. And some of the treatments and therapies that he had developed and that he utilized with our patients were just phenomenal. I used to think that brain tumors or pineal tumors or tumors that are on some of the glands in the middle of your brain were death sentences, and I come to find out after working over the years that they are not even close. Most people can recover from those and live pretty healthy, happy, normal lives. So if you ever have a chance to shadow an endocrinologist, and you want some pretty interesting stuff, then that would be the place to start. They do some pretty amazing things there. Okay, so overall, these are your endocrine glands in the body. You start at the top, you have your pineal gland, which is at the bottom. Back of your brain, you have your hypothalamus. Your hypothalamus is right in the middle of your brain. If you cut your brain in half, right to left, it would be in the middle of the right to the half section. So it's kind of like right there in the middle. And then your pituitary gland is in your brain as well. And then your thyroid and parathyroid glands, those are in your neck. Actually, if you push down hard enough on your neck, you can feel those. If you are a man, you can feel them underneath your Adam's apple. If you are a female, if you feel right above that little dip where your clavicles come together on your chest, then you can go up and feel. If you push hard enough, you can feel. If you push hard enough, you're probably going to gag yourself, so be careful. But you can actually feel your thyroid gland. Your thymus is in the chest. Adrenal glands sit right on top of your kidneys. That's where they live. Your pancreas hangs out in there by your liver. You can't see your liver in this picture because it only shows endocrine glands, but your pancreas hangs out back there, lives over there. If you are a female, your ovaries live down there. If you're a female, you probably already are very well aware of where your ovaries are if you've ever had a period. Those guys like to cause all kinds of fun pains for us sometimes. If you are a male, then you have testes, and you hopefully have figured out where those are. You know where those guys live. Okay, so we're going to talk about a couple of glands specifically. These are the more important ones. Function-wise, the pituitary gland is often called the master gland. It's also known as the master gland, and this is why. Look what this guy does. He exerts control over several of these hormones and organs. So over the breast, he exerts control over produces prolactin, which produces breast milk. The adrenal glands, he produces ACTH, which is adrenocorticotropic hormone. Thyroid gland produces TSH. This one screws a lot of students up on test questions. There's a hint, because they assume that the thyroid gland produces TSH or exerts control over TSH. But actually, it just stimulates the thyroid gland to grow. So that's a trick question there. Bone promotes growth hormone, ovaries, testes, which are the reproductive endocrine organs, and then kidneys for antidiuretic hormones, and then the uterus with oxytocin. So the oxytocin one is more of an under construction type of hormone because it really only shows up when the lady is pregnant. If a woman isn't pregnant, then oxytocin isn't a huge deal because we don't need to push anything out if you're not pregnant. So, okay, so the pituitary gland actually has two parts. There's an anterior and posterior. The anterior pituitary gland is also known as the adenohypophysis. Adeno is the med term for gland, which means that the anterior pituitary gland has the structure of an endocrine gland, and it controls the thyroid, the adrenal cortex, ovarian follicles, and the corpus luteum. All of the hormones that are produced by the anterior pituitary gland are considered tropic hormones, which means that they all stimulate another endocrine gland to secrete its hormones. So that's important to remember about the anterior pituitary gland. The major hormones produced by the anterior pituitary gland. We have TSH, which is thyroid stimulating hormone. This stimulates the growth of the thyroid gland. It also stimulates it to secrete the thyroid hormone. Adrenocorticotropic hormone is ACTH, and that stimulates the growth of the adrenal cortex, and it stimulates it to secrete glucose cortisoids, which the main one of those is, there's a few of them, but the main one is cortisol. FSH is follicle stimulating hormone. It initiates the growth of ovarian follicles each month, or eggs in the ovaries. Each month in the ovary, and stimulates one or more follicles to develop to the stage of maturity and ovulation. FSH also stimulates estrogen secretion by developing follicles, or again, those are eggs, and it stimulates sperm production in the male. So it's kind of important to our reproductive health. Luteinizing hormone acts with FSH to stimulate estrogen secretion and follicle growth and maturity. It causes ovulation, it causes luteinization of the ruptured follicle, and it stimulates progesterone secretion by the corpus luteum. It causes interstitial cells in the testes to secrete testosterone in the male. Couple of more. Growth hormone, that's kind of a biggie. Growth hormone stimulates growth by accelerating protein anabolism. It also accelerates fat catabolism, or the breakdown, and slows glucose catabolism as well. By slowing glucose catabolism, it tends to increase the glucose to higher than normal levels, and that's also known as hyperglycemia. So a hypersecretion of the growth hormone during childhood will result in something called giantism, and during adulthood it results in a disease called acromegaly. And in acromegaly, patients typically have very enlarged features, and so you can Google that. I don't think I put a picture on here of acromegaly, but you can Google what acromegaly looks like and kind of get an idea there. Hyposecretion of growth hormone during childhood will result in pituitary dwarfism. And so I have pictures I'll show you here in just a second for that. So prolactin, or lactogenic hormone, is the last hormone for the anterior pituitary gland, and it stimulates breast development during pregnancy and then the secretion of milk after the delivery of the baby. Okay, so this gentleman, who I believe appeared in the Austin Powers movies maybe, has pituitary dwarfism, so he had a lack of growth hormone. And then this gentleman, these gentlemen, there are three of them. This guy is sitting on a chair changing a light bulb. Blows my mind how tall he is. These gentlemen all have the disorder of giantism, so they had an excessive amount, or a hypersecretion of growth hormone during childhood. Okay, so that was the anterior. This is the posterior pituitary gland, so the back side of the pituitary gland. It is also known as the neurohypophysis because it has the structure of nervous tissue. Neuro, again, in med term, means nerve. So it has a couple of hormones that you need to be aware of. The ADH hormone is the antidiuretic hormone. It acts to decrease the urine volume. It accelerates water reabsorption from urine in the kidney tubules into the blood, thereby decreasing urine secretion. A hypo, or not enough secretion of ADH, will cause diabetes insipidus, and that's characterized by excessive volumes of urine. It's one of the telltale symptoms of diabetes insipidus is excessive amounts of urine. Oxytocin is the other hormone for this gland, and it stimulates the contraction of the uterus. It also causes milk release for breastfeeding. It stimulates the pregnant uterus to contract. It may initiate labor, and it causes glandular cells of the breast to release milk into the ducts. So here's the thing with oxytocin. If you have ever had a baby or know somebody who's had a baby and they have been induced, I was induced, I think, with 2 of my babies. If I remember right, it's been a long time ago. My babies are old now. If you have ever been induced, they gave you something called Pitocin, which is the synthetic form of oxytocin. And so that's what they are giving you. They are giving you a synthetic hormone which will cause you to start having contractions and then kickstart your labor. And just like we talked about in that positive feedback loop, once your labor kickstarts, your cervix will thin out and dilate, and then that will help your labor progress until the baby's born. So that's what they are doing when they induce your labor, is giving you synthetic oxytocin. So now you know. Okay, so the next one is the hypothalamus, and this guy is important too. He produces a substance called releasing hormones that travel to the anterior pituitary gland. So you saw all of the things that the anterior pituitary glands do. Well, this guy helps make that happen. So he's pretty important. That's why he lives in the middle of your brain. Like I said, if you cut your brain right down the middle, you'll find him right in the middle of your brain. So he's pretty protected in there. Okay, so the actual production of the antidiuretic hormone and oxytocin occurs in the hypothalamus, but after production in the hypothalamus, the hormones pass along axons into the pituitary gland. The secretion and release of the posterior pituitary hormones is controlled by nervous stimulation. I know that's a whole lot going on, and it's a lot to think about, but it's important to kind of try to grasp. The hypothalamus controls many body functions related to homeostasis, things like your temperature and appetite and thirst. So if you all of the sudden are ferociously hungry or constantly thirsty, although being constantly thirsty is a sign of potential diabetes, but if you are ferociously thirsty, you can't control your body temperature, you all of the sudden are very hungry, can't control your appetite, then it could be an indication that they need to have a scan done on your brain to make sure that there's not a tumor on your hypothalamus. Okay, so next is the thyroid gland. And the thyroid gland is very important because it can influence major body functions also. So most endocrine glands do not share their hormones, but the thyroid gland is the exception to that rule. It stores its hormones in the form of a colloid material in the follicles of the gland, which is kind of like a to give you an idea what a colloid material is, it's kind of like a gelatinous, fatty type of material. I know this is a really disgusting example, but when I picture a colloid material, this is what I always think of. If you've ever baked a ham at the holidays or, just for dinner, I guess, in general, at the bottom of the pan, after you have taken the ham out, if you don't clean the pan right away, at the bottom there's this gelatinous, kind of goopy, fatty, kind of clear, gross stuff. That is what colloid material kind of looks like. So your thyroid gland stores hormones in the form of this like colloid material in the follicles of the gland. So it just kind of hangs out in there until it's needed. The thyroid hormone group is important. There are two thyroid hormones. There's T3 and T4, and T3 and T4 influence every cell in the entire body. Like, they're that important. T3 is more important, but T4 is more abundant. In order for T3 and T4 to be adequately produced, the diet must contain sufficient amounts of iodine. So thyroid hormones their function is to accelerate catabolism, which is to increase the body's metabolic rate. So I'm going to tell you a story about iodine in just a second when we get over to goiters, when we get to the disorder part. So calcitonin decreases the blood calcium concentration by inhibiting the breakdown of bone, which would release calcium into the blood. So everybody knows that you need calcium to build strong bones. Well, if you have breakdown of bone, then it releases that calcium that the bones are storing into the bloodstream. So calcitonin decreases that blood calcium concentration by stopping the breakdown of bone. Okay, so your parathyroid glands are it's a group of 4 small glands that surround the back of the thyroid gland. So they are on the back side of the thyroid gland, and there are 4 of them. Para means surrounding, right? So parathyroid, surrounding the thyroid. So the function of the PTH hormone, which is parathyroid hormone. The function of the, oh, I wrote function twice there, sorry about that. The function of the hormone is to increase the blood calcium concentration by increasing the breakdown of bone with the release of calcium into the blood. Okay, so here's the thing. PTH and calcitonin are antagonistic, which means that they work against each other nonstop your whole entire life. They are both extremely important, like literally life and death depend on these. So the body cannot function with too much or too little calcium. It has to be at just the right level of calcium. And cells are very, very sensitive to changes in calcium. So if PTH and calcitonin are not working against each other correctly the way that they are supposed to be, then your calcium levels are out of whack, and that can cause a whole lot of problems for you. So it's very important. These thyroid hormones are, especially PTH and calcitonin. Okay, so thyroid diseases and disorders. You have hypothyroidism, which is hyposecretion, or too little of the thyroid hormones are being secreted and floating around the body. This may result from several different conditions. One of those is a simple goiter. This is a painless enlargement of the thyroid caused by dietary deficiency of iodine. So here's my little story about goiters and iodine. Years and years ago, I'm from the Midwest, and years ago, there was a whole big ordeal, and this is, I mean, we're talking decades ago, like my mom was little probably when this happened. We lived in a very big farming community, and the farmers would rotate their crops, but only so often. And when they got lazy, they wouldn't rotate their crops or put nutrients back in the soil the way that they were supposed to. And so when you don't rotate the crops appropriately, it depletes the soil of everything that is supposed to be in it, I guess, of some sort. I'm not a farmer. I don't know. This is what I was told. This is like a whole legend thing. So this whole discovery of goiters and iodine deficiency came when we discovered, or when farmers throughout the Midwest and the Plains states discovered that their soil was deficient in iodine because they were not rotating crops appropriately. And so they would plant the same thing over and over and over and over again, year after year after year, and season after season after season in these fields, and it depleted all of the soil from iodine. And so then all of the sudden, in these rural areas where the soil was depleted of iodine, all of these people started popping up with goiters. I mean, they would have these big massive goiters on their neck, and they would have multiple goiters. And so it was tons and tons of patients developed lots and lots of goiters. Little kids and older people, everybody had goiters all of a sudden, and people couldn't figure out why. Well, then they figured out it was because of the crop rotation. And then some brilliant genius, and I wish it would have been me or somebody that I was related to back then, some brilliant genius figured out that they could fix that problem by iodizing table salt. And so now when you go to the grocery store, you buy iodized table salt, at least before the last, 5 or 6 years with the health kick and the sea salt and all of that business. But typically, if you go buy table salt, it is iodized table salt, and that is because of the insufficiencies of iodine in crop rotation soil. And so they had decided to iodize table salt because most people flavor their food with table salt, and it was a very efficient, inexpensive way to put sufficient amounts of iodine back into people's diets, and then that pretty much all but eliminated the goiter problem. So it was a brilliant, effective, inexpensive solution to this outbreak of iodine deficiencies and then resulting goiters. So there's your fun history on goiters and the iodization, did I say that right? Iodization of table salt. Okay. So hyposecretion, or not enough during early development, may result in cretinism, which is retardation. During adulthood, hyposecretion may result in myxedema, which is characterized by edema or swelling and sluggishness. Hyperthyroidism is the opposite, of course. Hyper is hypersecretion or too much of the thyroid hormones. This increases the metabolic rate dramatically. It's characterized by restlessness and exophthalmos, which are the protruding eyes. I'll show you a picture there here. This, they sometimes call them bug eyes, but that is a classic symptom of Graves' disease. This exophthalmos is, which is associated with hyperthyroidism. Graves' disease is the inherited form of hyperthyroidism. It happens 5 times more often in women than it does in men. There you go. There's your freaky eyes again. And then goiters. Goiters have been, again, reduced greatly thanks to iodized salt. But these are the pictures of goiters. So, like, this lady has several of them. And they don't hurt. They are painless, although I imagine that this probably cannot be fantastic for her neck health. Like, that's got to be a lot of weight and pulling down on her neck. Aside from the physical deformity and the, potential embarrassment of the physical deformity, like, other than that, they don't pose a great big health risk, but, they are cumbersome and, nobody really wants them. So, and then this one is a smaller one. So that's a very extreme case, and then this is a more typical one. All right, so that's the end of Chapter 4's key points. If you have questions, you are always welcome to email me or message me through Canvas, and I will do my best to answer them. Thanks, guys.